My brother and I both kind of consider my dad our hero.
He worked in politics and he was really into his rowing. So he always was working out, on the weekends and whenever he got a chance. But also he had an artistic side, whether it's, painting something or drawing something.
I first learned about my husband Steve's leukemia. I got a phone call. I was up at school. Sarah called me and said, "Mom, Dad's on the floor in the bathroom and he's throwing up blood." So we ended up at the emergency room, and I do remember it being a very intense moment when our primary care doctor came and took me out of the room and told me, "It looks like your husband has leukemia." I remember sitting on the bed with her holding my hand and telling me that Steve had AML, which was extremely difficult to cure. We ended up using my daughter, Sarah, who was 13 at the time, to be the bone marrow transplant donor.
When I found out that it worked for him, and even though for a while I held some guilt about not giving him more time, I did give him 2 amazing years with us.
It was difficult for me to understand what the gravity of the situation was, and I just thought, Dad's gonna be sick. He's a big tough guy. He'll fight it out and he'll be fine in a few months or something. But obviously that isn't what happened.
He was such a brave person through his experience, and I think that really translated to my brother and I, and especially my mother.
I do remember that last day when I knew we weren't bringing him back. And the nurses, everyone was crying because that was it. And I remember him looking at me saying, "Why is everyone crying?" And because I knew he wasn't coming back.
Like Steve Vermillion, most patients with acute myeloid leukemia, or AML, have a very poor survival rate.
The cure rate for AML is stuck at about 30%, and it hasn't changed. We have to do better.
Leukemia doesn't discriminate. It can strike anyone, as health and fitness TV journalist Loriana Hernandez found out.
All the years of covering health and fitness stories and covering some very dire situations, I didn't know how to deal with my own story. Suddenly, I became the story. Friday night at 6 o'clock, I was diagnosed. By Sunday morning at 4 a.m., I got a phone call from Dr. Mark Levis saying, "Get on a plane. We have a bed waiting for you. Say goodbye to your son. You don't have time to wait." And it was the scariest day of my life, that flight, looking out the window, not knowing if I was ever going to see my son again. And the only hope I had was knowing that I had a support system like the Leukemia Lymphoma Society. Every day it began a series of losses for me. You lose your hair, you lose your sense of identity, you see your career go in a downward spiral, you temporarily lose your son, and then one by one you lose people on the hall, and you become terrified. Right now, the treatment we have is 40 years old and hasn't changed. There's a lot to be fearful about, but what there is to be hopeful about is I know that LLS is working on their Beat AML initiative.
Our goal through the Beat AML trial is to do that and to bring new treatments to patients and new hope. We won't be finished until we see this leukemia eradicated, and we have work to do to make that happen.
LLS needs your support so that we can fulfill our goal of finding cures for blood cancers and ensuring that every blood cancer patient has access to life-saving treatments.